enough.
Thank you, ma'am.
You're gonna read your statement.
Yeah.
You can never make a statement.
Thank you, Felice.
I'd love to have you up with us. I don't think it'll
Not that
matter for you.
Might matter.
She's on. How are you
The
doing?
pressure is on.
Much better.
Uh-oh.
Yeah, yeah, I do.
Let me make one.
1, 2, 3, 4. That's all right. I was looking at your embroidery.
Oh, I know, it's okay, but that's good.
Do you know when Brian's coming? Do I know when Brian is coming?
We'll cross it. Do a lot of.
No. Do you need to have?
I need to talk to him. Okay. Yes.
I'll see if I don't have a number for him. I'll
Okay.
probably call him direct.
Okay, great.
And that, I mean, it might be a phone call would help.
Yeah. Okay,
Okay, thanks. Yeah.
Do you hear that, Tammy? The transmission, my number currently on the transmission.
We don't know anybody that.
How old is it? I do. She has the warranty.
He's
It
wasn't that long.
No, what kind is it?
somewhere
Boy,
and he takes the track.
There's one kind that they have a bid on time, but boy, with the first ones.
yeah. She, was told to mend them last night.
I was gonna check around, but. I got paid to check.
Well, I can say that to somebody I know. And see what it's like. See, Jack.
You mind it? I like the embroidery. How much? Four. Nice. Oh, yeah.
Oh, okay. Thank you.
Yeah.
I got another one too. Just didn't try anymore.
This is for the record. Oh my God, what foresight. I have an extra. Hi, Judy. Thank you.
Well, you don't always get. I've had the ocular. That one I take. The oral, but yeah.
You want to start?
Sure.
Okay, well, I'm filling in because we don't have a chair and we don't have an acting chair. So I'm filling in to run the meeting. Please don't get any ideas for filling in. Okay.
I do.
No, don't get any ideas. Okay, so I'm going to call the meeting to order. And the first thing on the agenda is the approval of the minutes from September 13. So, should we give everybody a chance to review the minutes from September 13? All set? Oh. I think Judy's still reading it.
Everybody's
You all
deep
set?
in study.
All set? Okay, so I make a motion to approve the minutes of September 13th. Do I hear a second?
I second that.
Thank you. All in favor? All opposed? Abstain? So it's unanimous. So the minutes have been approved from last meeting. Okay. Okay. Paul, I understand that you have to leave early today.
I just have to be home by 2, so.
Oh, okay. All right. Okay, Paul, we'll make sure you get home by 2. Okay, so.
By 2.
Okay, so let's move on to the reports. Barbara has a statement that she would like to read. So let's move to that next.
Okay, I will also bring you up to date on what's happened. I've completed the calls as far as I know for the free Thanksgiving dinners for the 148 package store. I used the list that was created last year. Unfortunately, there are still phone numbers missing, and those people I've checked are my senior center updates, and I have no way of contacting some. I think I'm waiting for 2 people to respond to our email. That's a new thing that we are using the email list from the Herald, that people who get the Herald by email to actually generate other communications. And I think that's been a plus because we've received responses to the flu clinic, to the 148 dinners, those kinds of things. So that's a plus for us to be able to continue to use that.
Were you calling for the Thanksgiving dinner?
There was a list generated. They are people who were served dinners last year, all
Everybody got a dinner?
OPM seniors and veterans are eligible or asked if they would like a free dinner. Some of them were not on my senior center, so I have a list that was done last year that I have called everybody for. So we have about 22 or 24 people or 22 or 24 dinners that will be served that day.
Barbara, can you take a picture of that with your phone, your list, and text it to me?
Sure.
Okay.
Yeah.
Okay, because I'll put that into my senior center.
Yeah, I haven't done that part yet.
Okay, no.
Because we don't have any information. Most of them are just names without
Okay.
addresses and or phone numbers.
Okay, so when you get the total number of responses, just text me the list and I'll stick it in,
Sure.
okay? Because I'll create an event too.
Okay. Oh, that's great.
Yeah.
That's a great way to do it.
You said there were 24, 25 served last year?
Yes. Well, there are that many that I've contacted that will receive dinners, not 24 people necessarily, but 24 dinners for this year. Can't think what else we've done other than the email.
Well, we are participating in the vaccine clinic with New Braintree and Hardwick, and I believe Luster as well. And we emailed it's all electronic this year. So we were sent an electronic form and we sent that out. So we gave people the electronic form or the link, that they could use the link to get the form. And I gave them the option, if they were having difficulty with either one of those two, to tell me what that is that they wanted for the vaccine shots, which could be either one or all of the following three: RSV, flu, and COVID. And I would fill out the form and send it in for them. So 2 people came to me and asked me to fill out the form for them because they were unable to do so, and I have sent that in.
We have no way of knowing exactly how many have responded, though.
We don't, because it's all electronic right out to,
Right.
to the organizer,
We
Lester.
were supposed to get 45.
Yeah.
And that's why we contacted New Braintree
Yeah.
with hopes that to build that number. Because we had more than 20 ourselves.
We had a number of people that expressed, quite a number of people expressed in the flu clinic, and we said we would send them the information when we got the information. So it's going to be November 6th at the New Braintree Town Hall between 10 and 2. All you have to do is show up, and you had to fill out the electronic form and send it back electronically.
You didn't get it?
It's a document on Google. So whoever's controlling the Google document website is the people that are collecting the
I don't
information.
think I got that form.
I didn't even.
You won't get a form. You will get a link.
To a form.
You will get a link or a QSR code.
I don't know that I got that either.
That's a surprise. Okay, so you know what? You didn't either. Okay, Kathy.
Unless I got it and I didn't realize what it was.
That could be.
Yeah.
So let me pull up that email and send it to you, Becky, and to Kathy.
Robert, did you say you called people about the flu, about the vaccine clinic too?
No,
No.
we sent that out electronically.
Yeah. We sent them a broadcast message and we asked people if they would be interested. We got quite a number of respondents coming back saying they were interested. And then we had to wait until we were given a definitive date, time, and place. And when we got that, we were also given the QR code or the link. It's all going to be electronic this year. I said, lots of luck with the QR code. So that's why I offer people that I'll do it for them if it was too hard for them, I'd do it for them. And I did. Mhm. The world is marching on. World is marching on. Okay, I can't think of anything else. Huh?
Everything else has been going smoothly. Did you have people Monday? You were here
I don't know,
Monday?
I heard Paul came in, but I was in the office and I didn't see him.
Oh, okay. All right. And, okay. I guess
No
that's.
one else came in.
So I guess, would you like to go up here and read that statement?
No, I think, I'm
You
loud.
want to do it here?
Okay, I'm loud.
Okay.
All right. So I have thoughts on the future of the Ocam Senior Center. And I thought long and hard about the difficulties that we face in our Ocam Senior Center. And some of what I say will be repetitious, I am convinced. But I think it's important enough to see the reasoning behind where we are at before I make the suggestions. The major issues include staffing, the restrictions placed on us by our location, and the changing culture for the future of all senior centers. And the question is, where do we go next? In Ocam, despite our efforts, we currently serve less than 5% of our senior population. I believe in the past year, we served 22 out of 571 seniors living in Ocam. And there are a variety of reasons. Some seniors are still working. Some seniors do childcare for their families. Some seniors continue to have busy lives traveling, et cetera. Unfortunately, some seniors or their loved ones have health issues that prevent them from participating outside their homes or keep them involved with multiple doctor visits and treatments. And some seniors remain just too young to be involved in a senior center. For the past 2 years, the Council on Aging has tried diligently to accommodate the needs of our community. We face daily restrictions from our facility. We have been faced and corrected many issues like faulty electrical systems, neglected and therefore disreputable spaces needing to be reorganized and cleaned so that the public could be comfortably invited to use them. Lack of equipment like computers and printers, lack of means of phone communication from the public. Restrictions for the use of the kitchen 4 days a week, allowing us water only from a water cooler or by bringing in our own bottled water, and limiting our food activities to 1 day a week, Friday, when many seniors are engaged in other events or perhaps traveling for a weekend. And most importantly, there's no space large enough to accommodate our most popular events like Zumba, yoga, and functional fitness. Claire reported this morning that New Braintree was packed with 18 women.
Not an available seat. Oh, no, 17 plus Jacob.
Oh, Jacob, that's right.
Jacob.
In spite of these limitations, we persevered with one paid employee for 8 hours per week and our 4 to 7 elderly Council on Aging volunteers. We have all done the jobs of bringing in water, food, equipment, and being present for all our activities when our health, schedules, and abilities allow. We've upgraded the usage capacities of our limited space, spent hours writing, editing, and distributing the Herald, clarifying and maintaining our grants and finances, and helping with a vast array of activities, including movies, speakers, potluck lunches, holiday gatherings, as well as those services provided to our seniors like podiatry, Shine, and blood pressure clinics. All that is wonderful, but many of us are worn out and have health issues and personal concerns. We are all seniors who should be enjoying our retirements. The Council on Aging is supposed to be an advisory body that does not do the work of a professional director. In Ocam, in order to keep this center open, the Council on Aging has no alternative. Many of us have been here daily running activities which require our time and physical ability. I was recently told when questioning our ability to move furniture, well, who else do you think will do it? Enough said. Going forward, I don't think that it should be assumed that the Council on Aging can continue to work in this manner. Therefore, I'm making the following proposal. I don't think that we should merge with another senior center. All senior centers are having similar issues, although most at least have a paid director, an outreach coordinator, and perhaps an activities coordinator. Many have friends groups that lend support both financial and physical. Many offer many more activities than we do. But our seniors are free to choose to go to any of those centers without a need for merging to partake of their offerings. Most of our seniors are still mobile, and many would take part in activities that we can only dream of offering in Ocam. It's my belief that Ocam needs to remain autonomous. We would maintain the use of our revolving account, formula grant, and be able to access our donations account for special situations. The formula grant would pay salaries for Zumba, yoga, functional fitness, and podiatry activities, as well as other activities we might choose to offer. If we were to merge, we may be asked to give up our formula grant, as well as to pay for staffing in another senior center. Without our senior center, our other financial accounts would go back to the town's general fund. It's my belief that we should maintain those services which are important to Ocam seniors. With our volunteers in place, we can still offer podiatry, blood pressure glucose clinics, Shine, Pen Pals, and Lunch Bunch. Those are the most popular that we have, other than the remote exercise programs that that are still run by Melanie. Since Elder Services provides the Meals on Wheels and congregate meals, they would remain intact, and participants in those would still have our health clinics available to them. The time commitment from our COA volunteers would be reduced to 1 to 2 hours per month in most instances. I think we should suspend the distribution of the Herald. We now print for mailing about 75 copies. We also email 70 plus copies. There are several duplicates for people's preference, and we mail to other senior centers. We could still have a set weekly, monthly schedule that can be made available through an email notification, which seems to be working, newspaper listing, and the electronic sign. In the past, we have done townwide mailings asking for people's addresses and phone numbers so that we can better communicate with them. The return has been a dozen or less over 2 years, and the percentage of participants in activities indicates that it's not effective. One townwide mailing took a total of 22 hours of volunteer time. That's not to mention the cost of mailing as it continues to increase. We could continue our most popular activities, Zumba, functional fitness, in their remote locations of Rutland and New Braintree with their instructor paid through our formula grant. All this could work if we work as a team with each of us stepping up to be responsible for one activity. Most of that is already in place. Judy and Becky have done a great job organizing podiatry. Priscilla is great at writing our cards and making lunch bunch reservations. Kathy has stepped up for blood pressure, the blood pressure clinic. Judy and Priscilla have done the pen pals. I've done the Shine appointments and have been available for the blood pressure glucose clinic. If there are some of you who don't have a specific activity as yet, perhaps you could step up to take on one where you see people having duplicate jobs, or be ready to be called to be backup in the event someone is unable to do their activity that month. Still to be worked out are the best way to cover the phone calls. They can be received as voicemails that both Claire and I receive. Claire and I have worked together to answer those calls and the other email requests there may be. I would like to see us work together to do this. We still need our treasurer for our accounts and our secretary to organize our meetings. I would like to see the rest of the board coordinate our efforts without the need for a chair. I too don't want anyone to have to deal with who else do you think will do it? It's been the pervasive attitude for too long, and we as participating seniors in OCAM deserve better.
Okay, I'm going to move to the next issue on the agenda because it'll reemphasize what Barbara has said. So I'm just going to let that sink in for a couple minutes with you. And I'm going to move to the financials, and then I'll come back to, as I said, what would emphasize the points that Barbara has made. So before you see our financial status. If you look at our operating budget, the only money that we have spent is a little bit of money at Walmart, and I can't remember what the other place was, to replenish some of the supplies that we needed. So we've spent year to date $65.95. We have paid for our My Senior Center, and we have paid for our professional membership for MCOA. Beside that, we've been taking most of the other money out of the formula grant. Our donations, now this is going to be unofficial because not all the revenue has been posted yet. In fact, I was able to get a trial balance all the way up through July from Lori Barkis. And because we went May, June, July, 3 months without it, June, July, August, and September without a trial balance. And I was getting very nervous, and I told Lori, I really have to see a trial balance, because if you start to part ways, then you have to do a reconciliation. If you're reconciling over 4 months, that's going to take time. And so she did send me the trial balance. I'm glad she did, because we did part ways. So our donations unofficially And that's under the unofficial column down at balance at end of September under donations is $9,110.72. And that is because our deposits for August and September have not yet been registered.
9,110.
Yeah, 9,110.72. We parted ways on the donations because we have filled out the form to donate some money to the donations, and I found that went to the revolving account. And you know what? We're going to leave it there. Because the amount of money that was is going to cost us more to adjust the accounts. So forget it. It's in revolving. That's fine with me. For the revolving account, we once again parted ways, had to do with that donation, but now we are together again. Then let me just say that unofficially, at the end of September, we have $4,320.72 in our revolving account. What has not been posted yet by the town accountant are deposits that I believe she has not yet received. So she's missing a $20 deposit in July. In August, $140 deposit, and in September, $344.75. I don't think we're going to see a lot more deposits to the revolving account. And the reason for that is because we are so limited in volunteers and because Barbara's burnt out and we don't have people that can necessarily attend Zumba or attend functional fitness. We made arrangements with Melanie that she collects the money and then she bills us the cost of the class minus the number of paying participants times the $2 that we charge. She bills us the balance. That's why she gets the money up front. It's good for her cash flow, and for us, we don't have to be there. Now, she's been texting me copies of the participants, so I have copies of the participants so I can log this in remotely from home. Okay, so we had a little hiccup on the first invoice, and I think we got that worked out, and now we'll see how well we're going to do when I get the rest of the invoices. So we will not be making deposits from functional fitness, nor will we be making deposits for Zumba. So looks like we're going to be steady state here in the revolving account. Formula grant, we disagreed on the formula grant. Once again, we parted ways. I had balanced everything up through May, so I knew the disagreement was somewhere between June, July, August, and September. So I don't know what closed out in the month of June, because now I'm looking at what's been posted since July forward through the month of September. June is now a void. That information I don't have. I could sit in here and pull the vouchers, but I decided that no, I wasn't going to pull the vouchers because I was off by about $72. And $72 is damn close to the Mattel billing. And so I'm assuming there was a June Mattel billing. And so I've just made an adjusting entry for our book so that we are now in agreement on the formula grant. The formula grant, we have officially, the book showed $2,664.95, but unofficially we have run it down to $1,369.95. I hate to get on my soapbox, but I want to make a point here. And that is that unless departments have accurate information, if they are going by what the town records are saying, we are going to run into financial trouble. We are going to be spending down accounts that the town doesn't show we're running down. And there's going to be some rude awakenings unless people are keeping duplicate sets of books. So timely postings is essential. I am keeping duplicate books. That's what I can reconcile. I don't know if other departments are, but I am keeping the duplicate books. And I can see right away, we're off by what? $1,300 that the town says we have and we don't have.
Is it 1396?
$1,369, and I'll give you this, so you have it for your notes, you don't have to worry about it, yeah. Okay, so now I get off my soapbox. All right, okay, so In any case, I did talk with Rutland because I'm very concerned. I have not seen anything from Adam Frank for the formula grant. I have been in contact with him. He said that the survey is not coming out because they're discussing 3 additional questions they want to add on to it. And they haven't made a decision yet, and they will send it out when they've made that decision. In the meantime, he sent me a sample of the questions that they're going to ask so that I can be prepared. I talked with Nancy at the Rutland Senior Center, and she checked her files. She's seen nothing from him either. According to our records, we got our first part of the formula grant in November, and the second part came in March. Nancy told me you don't have to have those surveys completed to get the formula grant. They tend to send it out anyhow. So I'm going to be anxious to see if we get any replenishment of our funds come November. And that's the story on the formula grant. All right, now, so Barbara and I had talked a lot about what was going on at the senior center. And so I've identified, I'm just reiterating Barbara. So if you were listening and you need a refresher, here comes the refresher, okay? First thing, major issues we have staffing. Second issue, space restrictions based on our current location. And 3, the changing cultures and how it's affecting the senior centers. So, reiterating Barbara again, in Ocam, despite our best efforts to attract the senior population, we serve less than 5% of Ocam seniors. Now, the information I'm presenting you here is based upon the information I downloaded in preparation for the report that I will have to turn in for the formula grant. So I have downloaded the information based on fiscal year 2024 participation in the senior center using the annual report in the My Senior Center. I then took that data, because at that point it's data, it's not really information, and I organized it so that I could see each individual name of somebody that has come here. Okay, now the count out of My Senior Center was 120 distinct individuals that have come to the senior center. But when I reviewed the list and ran it through the Excel function to eliminate duplicates, it came down to 96. So 96 people out of 570 have come at least once to the senior center. Now that includes Meals on Wheels. That also includes congregate meals. Lumped everybody in together. When I further looked at that information, it came down to there are only 22 seniors that have come more than 10 times to the senior center. Everybody else is one here, one there, one there, one there, one there. I excluded congregate meals and Meals on Wheels because they tend to have a steady participation, so I eliminated them. These are people that come to our activities. So we're looking at 22 people, some of which may no longer be with us. So,
And 10 of whom are here.
and 10 of which are sitting in this room, okay? So data from My Senior Center shows that over fiscal 2024, we served 22 out of 571 seniors in our town. The statistics subtracts out the regular users of the congregate meals and Meals on Wheels. It includes only those who participate in senior center activities and have used the center at least 10 times during the year. Our issue is not isolated, as comments on MCOA Info Hub indicates that other senior centers are finding that only a small segment of their population participate in their programs. We can only postulate the reasons. Many working longer, not old enough to go to the senior center, a more independent, active senior community, family obligations, and so forth. So we have 3 options. Option 1, remain open, but at a reduced capacity. 2, close. 3, close and merge with another senior center. Remaining open as is not an option. So let's consider the options. We'll go with option 3 first. Close and merge another senior center. Currently, seniors from any town can go to any senior center and enjoy the activities they wish to participate in. Some senior centers ask for a friend's membership, typically around $10. If we merge with another center, we can expect to have to pay to that center for our citizens' usage. The question is, if we only have 22 regulars, why would we want to pay another senior center to absorb that small participation? Why would we not want to go with option 2 and encourage our seniors, and that's closed, and encourage our seniors to take advantage of the offerings at any senior center? These senior centers have directors and activities directors, and some have an assistant director. They are better staffed and funded, so they can offer more on a regular basis than we can. Now, I made that statement based upon going onto other town websites and pulling their annual budget for fiscal 2025. So, for example, for North Brookfield that we visited, they have a director who's paid $19,800. They have an assistant director at $18,000. They have an activities coordinator, and they have a janitor for $6,000. Okay, I didn't look at the operating budget.
What was that last one?
That was North Brookfield.
No, I mean,
And they have a janitor.
Yep.
Yeah, because they have their own building. They have their own building, so they need a custodian.
Yes.
Yep. Option 2 is close. This option means we would not be open for anything but congregate meals and Meals on Wheels. We would encourage our seniors to go to any surrounding senior centers for activities and socialization. And then option 1, remain open at a reduced capacity. I favor this option. But to make it work, there are factors that we would have to take into account. These factors are: 1, staffing. We do not have a director or activities coordinator. COA members who are supposed to be, guiding, are trying to cover the senior center to keep it open. The number of volunteers we have is a half dozen or less. If volunteers can't help, the responsibility falls on Barbara Wojcinski, and she has absorbed the vast amount of work at the senior center. Barbara is burnt out and can no longer provide the burden of support required. Other volunteers are having health issues of their own within the immediate family. Staffing is a serious problem. We just don't have the people to man the senior center. God bless you. And we have lost the activities coordinator that could plan and follow up on activities. In addition, we have continuing difficulties recruiting members to the COA, as is obvious by the empty seats. Space. We do not have the space for activities that have the highest participation, requiring us to scrounge around for space in other towns. These are the fitness activities, Zumba Gold and functional fitness. Skills level, technical skills, My Senior Center, phones, computers, etc., are increasingly necessary, and we have a serious gap here. If we wish to keep our center open, therefore, we have to scale back to what we can handle. My Senior Center shows the most popular activities are, and I ranked the activities by the number of people that came over the course of the year. Most popular, functional fitness, Zumba, walking group, not necessarily in the stats, but I know. And I have to say that Allison gave me a year's worth of stats that I entered. So I would update it, and we will continue to update it. Podiatry, because if I hadn't gotten the stats, I'd been on the chopping block. The lunch bunch, scaling back to senior center means we only keep the activities above, and blood pressure and the blood pressure and glucose testing, because we have that covered, and pen pals. The suggestion to keep these activities is based on the fact that we have them reliably covered and people come. Functional Fitness and Zumba Gold have a home for now, and Melanie Silva has agreed to apply the collective payments against our bill for her services. No member has to go to the sessions to collect money. Walking group, we communicate via text, and this flexible group meets and self-manages. Podiatry has a sponsor, a volunteer who opens and covers the necessary for the service, Judy.
Two.
And Becky as backup.
And does reminder calls so that we are assured of the people coming that day.
I want to get to that point.
Oh, sorry.
This is a little sore point with me. Blood pressure and glucose testing, same as podiatry, covered by Kathy Clark-Wren. So let me know if I make a mistake or leave somebody out, please, okay?
Don't do the second one, I only do the first.
Does the first one, okay. I don't know who does the second one, Barbara. Lunch bunch, we can decide at the lunch when and where we will meet, a big help for Priscilla, who will continue to make the lunch reservations. On the chopping block, the Herald, if we are not scheduling new offerings, the Herald is no longer necessary. Socialization hours, movies, lunch and learn, potluck lunches, trips, all else not specifically mentioned. Barbara has offered to cover the phone calls the senior center receives with Claire's assistance. We would really appreciate another person step up and back us up. That would be very helpful. Claire Hinder will continue to cover the financials in my senior center. Priscilla will continue writing our thank you cards in addition to making the lunch bunch reservations mentioned above. Judy and Priscilla, I do have it right, okay, will continue the pen pals. If we lose the volunteers above and no one steps up to own that program, then it too will have to be cut. The above, of course, requires that we continue to get the formula grant and town funding. The COA will continue to exist and will decide the disbursement of funds. It is hoped that by removing or limiting the COA and day-to-day running of the senior center, we can recruit members for the 2 vacant seats, chair and vice chair, and keep the incumbent seats filled. Let me emphasize, no one person can carry the senior center. The COA board is not supposed to be running the senior center and only has been doing so as it was our only option. We need people to reliably pitch in to make the center a success. Now, the reason why I flinch with calling people to remind them of appointments is because we have Shine representative. And I had suggested to Barbara, because we had discussed keeping Shine going, that we just give the Shine number to people that want to make an appointment with Shine. But we cannot do this. We have to call him so he can tell us.
We need
So
to,
we can tell the people.
we need to call him when we make the appointment. And then 48 hours before the appointment, we are to remind the people coming to his appointment and him that he has an appointment.
So I was warming up to that one. So here's a man who is obviously unable of managing his calendar. So we have to call him up and remind him to do his job. Now, I really take exception with that. I really do. And, I'm a little bit concerned about people who cannot remember that they made an appointment with somebody. And so this falls upon somebody else to sit as a middleman and say, oh, by the way, did you remember that you have to do this? And to call them up and say, oh, we want to make sure that you're doing your job today. Would you make sure that you come? Because you've got 3 people. I really take umbrage with that. So this is the kind of thing that sucks up time that is no value added. May I emphasize, no value added. These people, if they're going to do the job, should be responsible enough, or make an appointment, should be responsible enough, get the tushies up here to do that job or to come to their appointment. This is an added burden on seniors who are already volunteering and have other things that they need to do with their time. And I'm sorry, but let me vent on that because, You know, there's some people that could use a real good boat slap, and that guy from Shine, in my book, is one of them.
I wonder if we would have tried to pull that same thing if there were many who's dealing with at the senior center as opposed to women.
It just upset me because there's Barbara making appointments. Now, instead of calling directly, make an appointment, so both of them have an agreement. No, you have to go through a middle person. Totally no value added there. No.
Could it be a legal reason why they?
What?
Could it be a legal reason why they can't just, call each other? Why they have to?
Well, if there is, I'd love to know what that law is, because that is the stupidest thing I've ever heard.
Because like you, I find it stupid that
Yeah.
the person can't just call him and that they have to go through us. So
Well-
I'm thinking there's got to be a reason for it.
Even worse than that, you have to call him to remind him to do his job.
Show up.
The call
Oh,
comes
that's
in,
stupid too.
Yeah.
the call comes in.
Okay, not for that. Not for
Voicemail.
the dead schools.
Someone is reaching out to the senior center for a Shine representative. I take that person and I say, yes, we have an appointment with our Shine representative. Usually, there is a specific time set, the third Thursday of the month between 10 and 1. This month, he could not do the third Thursday of the month and offered me 2 other dates. And me, in my old age, did not remember that the first one that he offered me was a full day of podiatry and coffee. So I ended up changing. There are 3 people that are going to be seen this time. So I ended up changing it to the second date, the 23rd, and redoing those people, recalling those people or sending them notes or emails to say, sorry, it had to change because of too much activity in one day. Please come at these times on that date. Now, you're right, Claire. What I will have to do is before that, 48 hours before that date, I will call him to remind him. And I am then according to him, to reach out to each of those 3 people who have made appointments to remind them, so lest someone not show up.
So this guy is using us as his personal secretary.
Yep.
And let me just say that personal secretaries have gone by the by. You don't have them anymore. Not even executives have personal secretaries anymore. They share one. They do their own work. So I'm not going to beat the dead horse. That horse is beaten. So I will move to the next agenda item, and then I would suggest Paul is next.
And we're going to talk about these proposals? And statements that you guys,
Well, I think what we need to do, I'm sorry, Judy, yes,
Actually, you're doing the same thing in podiatry,
I know.
okay?
I know,
Okay, the thing of it is I feel very responsible because we have, my problem. I feel responsible because we have people on the waiting list. This is a popular clinic and we always have people on waiting lists. And now sometimes we have to put them off by months.
Right.
And so if somebody has a cancellation, I want to jump on that right away
Yeah.
so that I can give that next person on the list an opportunity to get in there. Again, what would happen if I got sick? What would happen if I got in a car accident and Becky got sick and there was no person to go in that day to help podiatry?
Okay, so now there's a jinx on both of us.
No, it doesn't, jinx does not work like that. The
And-
jinx is, the medical jinx is when you go into the ER and you say, gee, it's quiet today. That just allow the busload of people to come into that ER. That's the jinx. This is not the medical jinx. I've been a nurse for 50 years. I remember that.
I wasn't,
Nevertheless,
I didn't mean anything to demean you in any way, shape or form,
yeah,
you know, but that Shine guy drives me just up one wall and down the other.
And in my mind, if I can add this, Allison is a wonderful addition. The podiatry gal is a
Yeah.
wonderful addition here. And she's gone out of her way. If people were to cancel without calling in, that's money out of her pocket if they don't show up.
Right.
She expects so many people a day. So we are also, I didn't want to cut podiatry. That's one of the
No.
reasons, because
Yeah.
she's wonderful and she does us a service. she's not requiring this, but I also have the experience that for the first year that I was on the Council on Aging, I was expecting that someone was doing what Becky and Judy did, and it wasn't being done. And people weren't showing up. And then there were big gaps. You don't want poor Allison sitting here at 9 o'clock in the morning and not having anybody till 11, that sort of thing. With these gals working, we can fill in those gaps with people from the waiting list, and everybody is served.
If you ladies are willing to do that, that's fine. But I find it offensive that the representative from Shine is using Barbara as his private secretary. Not that we don't have enough to do now.
Well, we know that our podiatry nurse is out straight.
She
Out
is.
absolutely straight. She is doing everything she can and she's wonderful. So we want to help her. However, I think we have to be realistic. I mean, I enjoy this clinic. I really do. I
Yeah.
enjoy talking to the people. The people enjoy it. It's a great clinic. However, I do think that we have to be smart about this because we're not getting any younger.
Yeah.
Who knows, we've seen in the last year, a lot of medical conditions have come up among people in our group, many of them. And so who knows when the next, thing is going to happen. So I think if we would be doing a justice to the group, if we could get it to sort of run automatically. Okay.
Oh, okay.
And I think if we could look in that direction, it's not going to happen maybe right away. But I think if we could say, okay, in the event that we are unable to be there that day, I mean, it couldn't even be us. It could be like a family member, a husband or whatever.
Yeah.
So I think that we should look into that
Now-
and work on that.
It's not that I want to cut the conversation short.
Mhm.
I don't feel that you have all the options before you because Paul has done research.
Mhm.
So that's why I don't know whether I should go to the secretary report or jump to Paul now.
Paul, since he's got to.
Yeah, let's jump to Paul now and then that'll bring out more discussion.
Okay, thanks.
Okay?
Thanks, great.
So just hang on to your comments because we have one more option to hear. Or flushed out. Okay, Paul.
For the recorded record, Paul O'Shea, 161 Gaffney Road. At the last COA meeting, I volunteered if the COA would authorize me to contact the adjoining towns to see about the possibilities if they would be willing to accept the OCAM residents into a merger into their centers and to come back with the information. I contacted the town administrators of Barry, North Brookfield, and Rutland. And told them that I was not a member of any board in town or anything. I was a volunteer, but I was authorized to solicit the information to bring back to the COA. And from that standpoint, talking with all the administrators, every single town is very receptive to bringing OCAM into their centers. I told them two basic questions. I really needed to know what the financial obligations would be for OCAM to do that, and whether or not we would, be found acceptable to join. I've had very good conversations in all three towns. I did happen to go to the open house at the North Brookfield Senior Center. I think each facility has good points and maybe a couple bad points. But I found basically all the staffs in all three places were very cordial. And I was impressed by all three places personally. I happened to go into North Brookfield the other day when they have their vegetable giveaway and their bread giveaway. I want to tell you, they had 3 long tables that totally covered with vegetables that they were given to North Brookfield residents. Then they had 2 long tables with every kind of bread you could ever dream of. that they were giving away. I mean, they do an awful lot for the seniors, okay? They have a schedule very similar to ours of all the events. They have a very active Friends of the Senior Center. I mean, I probably met 15 or 18 volunteers that weren't even on the councils there. So it's definitely an option to look at. I mean, I don't think it would be really any more expensive. I really don't have the figures yet, but I think it wouldn't cost any more to merge than it costs to actually run a senior center here.
Okay, I have to ask though, podiatry, we have, and I don't understand grants, okay, I'm gonna right up front. However, people they pay $15, okay, because of this formula grant, right? And if they went to having nails done at another senior center, they pay like $20.
Okay, Allison goes, I know to Rutland,
But
okay?
I'm trying to like,
Rutland said that if we did merge, they would set up a second day for Allison to treat people over there.
it's not the day, it's the $15. That's what I'm, like, maybe some people couldn't afford the 28 and we can offer them $15 to get their nails done, right? With a grant. And that's the thing that
I mean, also the point is, you don't have to provide somebody to sit downstairs all that time. You have a staff over there that's gonna handle all of that.
okay.
I'm just saying, that these are the options, okay?
Okay, there's no way you could transfer.
Like in Rutland, okay, they have a room that they use as a salon. Once a month, they offer haircuts, okay?
Mhm.
They offer manicures. They do have Allison over there for a day, you know, all by appointment, same setup that we have here, okay? Thing to look at, I would suggest that everybody at some point try to see what, you can go online and get their schedule, see what they offer, just to get an idea what the different centers have for good points. Barry is the closest. Barry is 5.5 miles from this building, okay? Both North Brookfield and Rutland are about 7.5 miles from this building. They're all reasonable commutes. They're not bad. Again, I mean, if we don't have people to run the center, it's an open option. I mean, it's a better option than trying to close and saying we don't have the ability to serve the seniors in town.
That's right. That's right.
I think probably one of the priorities of the COA is to be the clearinghouse of information when somebody needs assistance for something. You can look up and find out what agencies are available or what personnel are available and connect. And that's what all the senior centers do, okay? So that is available if you go to another senior center. And if you're going for a merger, you're gonna be treated like every other person there. You're not gonna be treated as an outsider. So again, I'm still compiling information for the COA. But I would ask everybody, take a look at their program, see if it's something that you personally might feel would work or not work, and voice your opinion. I mean, all I'm just trying to do is gather information and provide probably available avenues for the COA to decide what's going to be best for the seniors in town. I mean, nobody wants to be married to that room downstairs. And that's what's happening right now. Everybody, I mean, this has been a tough month, I'm going to say, for everybody. Everybody's had either medical issues or all kinds of appointments or home problems. I mean, you name it. And those come first. I mean, take care of yourself first. You can't just drop everything from home just to come up here. And I think everybody deserves a big round of applause for everything they've done already as volunteers. But I mean, it's a decision when everything is compiled, whatever people decide is going to be the best route to take. I will say, from my own, this is personal, from my own observations, I think OCAM is going to be under the gun financially for the next fiscal year. So to try and think you're gonna keep the senior center open partly and also go to another town, I don't think that's gonna work. Or to decide whether you want a part-time director. I mean, you gotta come up with what you feel is gonna be adequate time and an adequate salary. And provide that information to the, the select board. And they're probably gonna require an article on the next town meeting. I think this is a decision that needs to be made before the next town meeting, if you want to try and have a sense of direction on where you're going for the next year.
All right, let me add to that, Paul. I have to ask Adam Frank a question. I figure what I'm going to do is also ask him if they have any experience or he can give me some guidance on what happens to formula grants definitively if you merge. Yeah, I was thinking that they would pick up our population, but since it's census by town and it's the federal census, that it may be that you don't qualify for the formula grant. So I just want him to tell me that definitively. I want it in writing.
Well,
It's my,
Hardwick is merged with Barry.
Right.
I don't know if Barry takes the population of the two towns when they submit their request for the formula grant. I really don't know if Hardwick does it and then turns it over, because I know Hardwick turns over their formula grant to Barry.
Okay, well, I'm going to ask him exactly how it would work. But I want to have a good definitive understanding so that we know what we're dealing with stepping forward. So I will ask him that.
Because I had never been involved in soliciting the formula grant, so I don't know what the data requirements are that get submitted,
Well, what happens is that when a formula grant comes out, it comes out by town. So you can see anybody's town, see what they get for a formula grant, but it states this town, population, and then the amount that they're going to get. So it goes by town. So,
Well, the question is whether they can move around.
yeah.
But that's the problem with subsidizing the podiatrist in Rutland. If we were to merge, they would have the formula grant, we wouldn't be in a position to subsidize.
I do know that the town administrator of North Brookfield is looking into, the state has programs for any type of regionalization.
Mhm.
And he was looking in to see if there was any funding available on the merging route idea. I
Mhm.
know that's one of the things that he was researching. So,
Well, why do you think it wouldn't be effective for us to scale back to a certain base level of activities in the senior center here and have our folks go over to whatever other senior center they wanted to go to for anything we don't offer?
but again, I don't think it's a question of that so much as a question of staffing. If you don't provide a staff member to, or somebody to be here when you want the place open.
Staff member.
But we would be open for the ones that are volunteered. It's covered by volunteers. So what we are thinking of is that there's a volunteer. And what Barbara and I saw when we went to the MCOA meeting at Holy Cross, other senior centers, the directors and the activity directors are not even as intimately involved in the activities as we are on the COA board. So they have what they call sponsors. It's a volunteer. And that sponsor is responsible for that activity. And they're responsible for the scheduling and making sure people come, getting it set up, getting it broke down. And they work out their schedule with the director of the senior center. So along those lines, we're thinking we have certain activities here that have quote unquote what they call sponsors. So those would continue. And that brings the issue that Judy has brought up that, well, if you lose a sponsor, then what happens if we're standalone, you know?
Okay, well, we're kind of at that point right
Well,
now.
there we are. Oh, absolutely, Paul. We are. You're right.
to add on to Rick's, right now, we have a situation where we pay Melanie, but the program is in Rutland and Rutland people are allowed to come. But that's our class It just happens to be in Rutland. So in my thinking is maybe podiatry could be essentially the same kind of thing.
But we can do that because we have a formula grant.
Right,
If you merge, you won't.
right.
Mhm. Mhm.
Possibly we won't.
And some of that is negotiation when you come up with, when,
Right.
you know, when the selectmen do a negotiation, that would be written into the contract. That these are the things that they want. So I mean, if that's something that we want, and if Rutland, for example, is willing to do a separate day for podiatry, then we could say, well, we would like to have it so that whoever attends on that day, this is where it gets dicey.
Yes.
This is where it gets dicey. You know, only pays $15 because the others are going to hear, well, why can't we have it? So it becomes a negotiation that everybody who goes to podiatry gets the same deal, because otherwise, yeah, you really have a problem on your hands, you know? We're going to gain citizens from Oakham like you can't believe.
Well, the only thing I can say, I mean, the idea is when you move into somebody else's house, you kind of live by their laws.
Yeah, you're right, Paul. You're right, absolutely on target. I would agree with that. Yeah,
Yeah.
so,
Anybody have any questions about what I've done so far, though?
Okay, thank you
No.
for doing that.
I'm still working on it.
For looking into that. I think you did a lot of work and appreciate it.
the key here is we can tell these towns that we have 22 regulars.
But would they be regulars in another town?
Well, it could be less. We can vouch that we've got 22 regulars, excluding congregate meals and Meals on Wheels. And the other thing that I was sensitive to was in North Brookfield, I asked about Meals on Wheels. So they have, the congregate meals are made by volunteers.
Right.
They have their own kitchen.
Right, they do.
Yeah. And the Meals on Wheels is not handled from Elder Affairs in Worcester.
Joyce,
Pardon? I think,
Tri-County.
yeah, Tri-County, yeah.
North Brookfield only serves one day, Wednesday, they, is in the meal day.
Yeah, I don't know how many they served in North Brookfield. I don't think I asked the question and I forgot. But what I was concerned about was that, you know, I don't know how long Jan will continue on, but I didn't want to undercut income to somebody that may need it. And honestly, okay, so that distributed at North Brookfield was from Tri, and we were Elder Services.
The Meals on Wheels go out more than one day a week.
Yeah, they only have they only serve one day.
Meals on Wheels too.
That I don't know.
Was that North Brookfield, Paul?
North Brookfield, yeah.
So, you know, it's the type of thing that if you wanted to do a merger, I would ask the selectmen to write into the contract that we will do our own congregate meals and we will do our own Meals on Wheels. Does that sound realistic?
It's a money thing.
Negotiation thing, yeah.
It's something that's
Yeah,
gotta be, you know, budgeted for and
yeah, yeah.
Paul, when you went to those 3 towns, was there one town that impressed you more than the others?
personally, I like Barry. I found Barry was very socially acceptable. I mean, you go in there, I mean, every morning there's coffee and, you know, usually cookies and snacks. They got a pool table in there, I mean, in another room, and a lot of the men are in there playing pool or playing cards. They have another room that's a library. I mean, that facility was literally built to be a senior center.
Right.
And I found, you know, their parking area is good. I found the staff very pleasant to deal with. And while I was there, I watched 4 people from Ocam come in.
Mhm,
So it's being utilized.
mhm, mhm.
And I know 2 people who do go to that center, okay, who would refuse to come to this center. So, I mean,
What was your, did you talk with the director?
Not in Barry, I didn't know, I talked to, the woman that did the, what do you call it? Outreach.
Yeah.
And she's the one who sent me up to talk to the town administrator.
Mhm. Mhm.
We do know of an issue there with podiatry that the new director has, I don't know the nitty gritties, but had a problem with podiatry, and Allison has left there. And there are 60 clients that are not being served now in Barry. And it was, my understanding, it was, well, where do you do it? And at the end, Allison was forced to be in a bathroom doing podiatry. So there's some issues going on there. I also know that with the new director, nighttime activities that have been open to the community, like Scouts, now my mind is going to AA and Lions Club, I believe, are not allowed in the building at night anymore. And again, this is all rumor, things that have been told to us at the open house or wherever. The podiatry has been told to us by Allison, so that's not rumor, that's a definite.
But we need to hear both sides.
We need to hear both sides, exactly. I've been to Barry too. It's a beautiful facility. I was there a long time ago now, and I was welcomed, as you said, it was cordial and pleasant and coffee and whatever. But I'm hearing these things just recently. I don't know.
Would it help if I added into the mix that I have a 1-year appointment? Treasurer, and will not seek reappointment.
Important,
It's important.
It is important.
because you know, you've gotten us through so much stuff. and
Exactly.
That's critical, yeah.
So just,
Yeah.
I tossed that out there, you know. So, I mean, these are factors to consider. Now, usually the gut feeling, it's kind of a good flag. You know,
Who's gut feeling?
yours. Everybody's gut feeling. You know, so I mean, so you've listened, we know that we can't continue as we are, so we could close. Anybody feel good about that? Except for Congregate Meals and Meals on Wheels. They're off on their own, okay?
I am really afraid that if we don't do something, we're not gonna get, we have a set group of people that can do it. But I don't know if we'll ever have that again, in the near future anyway, because, and you know, it just could be bad luck. It's more than bad luck, but it's, the thing of it is we're all getting older, our spouses are getting older, you know, in 1 year, the senior center has experienced a lot of medical things that we
Yeah, we have.
dreamed we were in,
Yeah.
you know, and that's going to continue to happen because that's a fact. So that, you know, do we want to take on something that maybe we can, we're biting off more than we can chew? Or do we want to make life a little bit easier for ourselves and just have the option of trying other stuff, you know?
By trying other stuff, you mean? Could you be detailed?
The merger thing sounds nice, but I'll tell you, I personally do things at other senior centers, all right? I do. And I always have. And it's easy, it's simple. The Friends thing is the easiest thing in the world. Because I do things in Rutland, I feel like I join your Friends organization. It's $10 a year. I give them 50 anyway. And I try to give them extra whenever I possibly can. I just feel like that's my feeling. I feel like they've welcomed me in. I'm going to give them, I'm not a member of the town and I'm happy to give it. It's very financially easy to do. The Friends thing is like, you do a half a year, it's $5. You do a whole year, it's $10 a year. That's all your exercise activities. You don't have to spend any money at any of these things. That means that all the people that have low incomes are, you know, welcomed into these centers without a huge financial thing. Am I forgetting anything?
No, well, I was just gonna say, there are a couple of things that require, like piano lessons, it's $5 to the teacher, but that's someone's choice and not
Yeah,
everyone's gonna take that one.
Yeah, that's, you're right. There are
Tina
always.
Bemis too.
Correct.
And what
Tina Bemis.
Tina Bemis's things
Yeah.
too, yes.
Yeah, that's correct, yeah.
Mhm.
So,
Well, you know, I see this as a two-step. Could be one step. Two-step is we have to really fall back. In the immediate future, we have to fall back to what we discussed. Because there's no way to do anything else. So if we fall back, then the issues to be considered for fiscal 2026 are if we continue at a reduced status, do we really need an activities coordinator?
Has that position been advertised yet, Lucy?
Pardon?
Is that position being advertised now?
No.
So do we need two? I mean, it would be nice to have somebody to make the calls. Be nice to have somebody answer the phone. And then stepping forward, if we continue on and reduce, then the question becomes, you need someone to be hired. Which comes to your point, Judy. So if we feel that we are going to be unable to sustain even a minimum activity level, then it would be better than to merge. I mean, this year, that's not in the cards.
I would also say, you know, take a look at the most vulnerable citizens we have in town, okay? So if they needed a service, and they called the senior center, they said, I don't have this, I don't have that, where can I find this? Okay. That service could still be done on the phone at another senior center.
Absolutely.
So,
I mean, you can work it two ways. Either they call the senior center or the phone through MyTel
mhm.
would be forwarded automatically to that
I
center.
think if we
Right.
made sure that our citizens, our vulnerable citizens had the awareness of where to call if they had a need. And that information could be posted at the town hall and the library, you know, just like the information you're
On
talking.
the town website too.
On the town website,
Yeah.
there's no herald, you can post this
Yeah.
information, you know, in other spots in the town where it can be seen by the public. So you're not abandoning the public. There are some things, unfortunately, maybe people will not be able to go forward and get their podiatry for $15 somewhere else. That's a possibility, and we can't do everything. We can do the best we
Yeah.
can, but we can't do everything.
Yeah.
But we can still offer emergency services, merging and other things. And we can also be volunteers at these other senior centers, because I am a volunteer.
Yeah.
I have been a volunteer at Rutland Senior Center.
Can I ask for a point of clarification?
Mhm.
And that is when you're saying about the vulnerable citizens calling a phone number,
Mhm.
did you mean to have us here in Ocam staffing that phone?
Well,
It's called.
we have a number here, is saying, yes,
Yeah.
we have a number for the Council of Aid, for the senior center. And if you said, I'm a senior in town and I'm having trouble with this, and I might call the senior center first, you know, then all you have to do
Our
is.
durable equipment is something we haven't talked about either.
Yeah.
Someone call, that's what you made me think of,
Yeah,
is someone
yeah.
calling in
Yeah.
for
Yeah.
a piece of equipment that they might need.
Just reroute it to wherever you are, you know, to the,
So,
give you another contact number.
right. Or we could leave it at this phone and just ask to have MyTel reroute it to Rutland. So
Right.
the number never changes for them. It's invisible to them. They don't have to worry about it.
That's right.
Yeah. That would probably be even easier for them, I think. Yeah. And when it comes to durable equipment, if we merge with another town, we can say, do you want it?
Right,
If they say no,
right.
Right.
I've already dispensed some of our excess to other towns.
Yeah, okay.
I asked them what they would like,
Yeah.
and we have duplicates of many of the things, so I've already done that.
Let me suggest the two possibilities that I see. One is that we continue as a council on aging and we get the formula grant each year. And basically, we act like the Cultural Arts Council, we give out grants. If somebody wants to come and propose that we have podiatry, they want to take responsibility for it, we give us money to subsidize that. Same thing with other activities. And if those people disappear, that the activity's over. It's like a grant being used up and gone. So I think the council on aging could continue to get the formula grant, continue to provide services, but not feel that it's responsible for managing them, taking phone calls, et cetera. We give out money to people who want to do those things. That would be one way of scaling back the council on aging's responsibilities. When it comes to the activities coordinator, I find it hard to make a case for $12,000 for 22 people. I think if we want to think about that job, we really should think about it in a larger capacity. If this person wasn't just serving the seniors, but serving in a community center.
Exactly.
And if we were at the school and we had access to a gym, things like that, this person could basically be in charge of that and serve the whole town. If this person served the whole town, one, I think they would have a lot more business to do, and it would justify the expense. Whether it's too big a job for somebody, maybe. But that's the only way I see to move forward with a part-time position.
I met several people just in that capacity at the conference we went to,
Did you?
that they were community people, but they were coming to the Council on the Aging conference
Mhm.
to see what they could gain for that piece of their
That's a
job.
piece.
Yeah.
It's having somebody at the school in the afternoons to open up the gym for kids to play. That'd be great. I did that for years with Duncan.
Right.
So I think there's some positive ways to go forward. What bothers me about this conversation is it seems very downbeat. We're talking about closing the center, merging and giving our money to another town. And it all sounds
Gotcha.
pessimistic.
You know
I think
why?
there's
Because
some
we're
reason for
tired.
optimism.
We're tired. The ones that have been keeping it going are
Yeah, I think
tired.
we need to think against that and think about what's best for the town. And if it's tired, that drives their decision making, okay, then fall back to a committee that just hands out money to people. Don't take any more responsibility than that. I don't think the Cultural Arts Council is burning people out.
Well, they are looking for members.
All
Yeah, they are.
all committees are looking for members these days, I think.
Every committee in town is looking for members.
Yeah,
Mm-hmm. Yeah.
I would like to keep a more positive slant on this.
Well, I think merging with another town can be very positive. Because you're opening up more possibilities.
Sure, but it means to the people in town is that we lost something.
And I think our scale back idea
Yeah,
is also very positive because it's saying
Yes, we
that
do.
our seniors in town are important. Some of us are at least seeing that those offerings are important to seniors.
I think we can do that with a fairly minimal personal investment.
Right.
but as Judy pointed out, and I think is a valid comment, because we have experienced in the senior center, a number of us that have had health issues
Right.
or health issues in the family, which has restricted their ability to volunteer.
Yeah,
I've been lucky.
so in order to volunteer for an activity, it
It's not happening.
disappears.
That's right.
Most folks try to get someone to replace them if they can. If they can't, that's it. There's not enough interest apparently.
Well, we got
You've always,
chair, we got the vice chair, nobody seems to be stepping up.
nobody would if it wasn't such a damn hard job.
No. That's, I think I addressed that in my comments.
So Secretary's report?
Do we need a plan going forward before when a decision could be reached?
I think, Paul, you're gathering information. You're gathering information, Paul?
Yeah.
I'm gonna fire off some questions to Adam Frank.
Can I just interject with Paul's reaching out to other people?
Yes?
He has reached out to Rutland, North Brookfield, and Barry.
Yeah.
We have heard from Barry. They have called the Board of Selectmen.
Mm-hmm.
indicating they were interested.
Okay,
And they said they would be willing to gather a committee together to discuss
mm-hmm,
the finances and anything else that they
Yeah.
feel that they would want to talk about. We've also heard from North Brookfield. We've heard from North Brookfield 3 times. They are very anxious.
they must need the money.
They actually put it in the newspaper.
They did.
Yeah,
They
yeah,
started
yeah,
them
yeah.
Time.
I think they need the
are
money.
Extremely interested.
Yeah.
And they've reached out to Maribel, the Board of Selectmen, and then soon just me, which
Mhm.
was fine, because then I turned it back over to the Council on Aging, to the Board of Selectmen to decide whether they're going to meet with them or not.
Mhm.
There, he is going to come Tuesday at the Board of Select meeting to discuss with the Board of Selectmen anything he has for options.
This is North Brookfield?
North Brookfield.
So it's not really up to us anyway. We should just go home.
So I would ask, are you just going to be listening to them?
Yes.
Because before we ever move forward, we'd really want to make sure the Council on Aging put forward the things that they want to see in the negotiation.
Right. But this is not a negotiation right
Yeah,
now.
yeah.
We're not to that point yet,
Yeah,
because we haven't heard from Rutland at all,
yeah, yeah.
which surprised me.
I'm not too surprised.
I thought they might be one of the first ones to call, but it wasn't. It was North Brookfield.
I don't, in defense of Rutland, I don't think they saw it as an immediate situation.
Yeah.
It's just a fact-finding mission. And what is our role as COA in the final decision, or is it a select board decision?
Barry said they would be meeting with their town administrator, the director of their council on aging,
Mhm.
and one member of their board of selectmen. That was who they would discuss the final
Yeah,
meeting
right,
and
right,
conclusion.
yeah. Mm-hmm. When it reached that point of contract negotiation.
Right.
Yeah,
It would be
yeah,
way
Yeah,
down at the
yeah,
end.
yeah. Well, I don't see why it's never too early to hear what people have to say.
Right,
At least you know where they're coming from, you
exactly.
know? And then we can take that and we can say, well, we like this, we didn't like that, and we want this.
Exactly.
Yeah.
I think a difference
Set our
might be
position.
that they're not just a senior center. They're a community center.
Right.
I don't think they need people. I don't think they're facing the same kind of financial pressures that the other centers might be facing.
Rutland, you mean, right?
Right.
That's what Rutland, yeah.
Yeah, yeah.
It's a community center in name, however, there aren't many community events that
No.
go on. It's mainly the seniors that are there.
Which is fine.
Yeah.
Like us.
Yeah, the sense I got was North Brookfield needed the money. Yeah, it was the sense I got.
I'm hoping when he comes Monday, he'll come with some financial information as well.
Yeah, we can go and look up their budget too. They have it posted on on their website. That's where I went. I went up to see what their operating budget was and how many paid personnel they had. Yeah, so it's same thing with Rutland. They have the same thing.
Yeah.
Yeah,
So we can hold off on hiring somebody for a while longer?
I think so.
Thoughts?
I should shut up.
Well, I agree with what you said, Rick. Serving 22 people doesn't constitute reason for hiring someone, in my mind. Not because, and I'll just back up to say that scheduling activities, creating activities, all of that is just as difficult for 10 or 20 people as it is for 50 people. The same amount of work goes into it prior to. So you're paying someone that's going to get not burnt out necessarily, but disappointed when they put in all the effort that they put in to not have the response.
Mhm. Yep.
We all go through that.
Yeah, yeah. Absolutely. Yep. Okay. So I think right now we have to just stay at this limited schedule that we discussed.
May I make a motion that we stay at a limited schedule starting, since we have events planned through October, starting in November 1st,
Okay.
and limit our activities starting November 1st. Now, it coincides with the holidays and that sort of thing anyway. And to have the discussion continue at our November meeting with any new information that comes forward.
Yeah. Well, I'm not going to state that. You have to state it yourself for the motion, because I can't remember all of it.
Oh,
What I was going to say is also, we have Bemis Farms coming up, and I think we just said we're keeping
in
Bemis December. So that's an exception because it's already been arranged.
Right.
And that may be the only other item that we take in money so we can then disperse the money.
You're saying starting November 1st?
Starting November 1st, that we suspend, or what's the other word I want? Not curtail, thank you, activities to a minimal. Those discussed in the meeting today, the health clinics and the exercise activities.
Okay.
And I have both statements, so you will have the information you need.
When are we going to make a decision about activities coordinator?
I don't see it for this year at all. That's my opinion. I'm sorry.
No, I agree. So,
I say not this year because what are we going to have that person do?
right.
Might not be easy to get it back next year.
Well, the discussions that happened this year, they mean we will not be having an activities coordinator. They mean that activities coordinator resides in Barry, North Brookfield, Rutland.
Yeah, well, I'm saying you're looking at a self-fulfilling prophecy. I mean, you can pretty much engineer us into a merger if we don't have anybody here to do anything.
Well, I think what happens is as we get this information coming in from other towns, then we'll make a decision. And that's important to get it in sooner rather than later. So when we work toward a fiscal 2026 budget, we'll know whether or not we want to put money into the budget. Oh, and Paul, what I did was I looked up the North Brookfield lady director that we met with. I looked up her salary. I divided it by the number of hours, and she gets paid about $21 an hour. And we were offering Melanie 20. So I said, well, we're not too far off the mark here. Okay, that's one thing I did.
But how many hours was she?
She is paid for 19. She works 30. She was very clear on that.
Right.
See,
Exactly.
I don't know how you can do the job for less than 20 hours.
And she has an assistant director.
So your division was not by the 30 hours, it was by the 19?
Yes.
Yeah, so she really makes half of that.
Yes, you're right. You're absolutely right.
$600 an
No,
hour.
I did the official numbers. I didn't do the unofficial numbers.
Yes.
Yeah.
But you know what was interesting, just as an aside, because this is an interesting fact. So there I am on the info hub, poking around to see what other people get paid, you know. And I saw a job advertisement in Brookline, director of the senior center.
Yeah.
$151,000.
Yeah, because I don't.
And I almost applied for it. I was like,
How much more do they get the higher it
Director,
goes?
yeah.
you know, I didn't look it up. I didn't go on and look. But if they're going to be, you know, if North Brookfield's coming, we should really do a little chart, you know, who they have, what the salary is from the fiscal 2025 budget, and then their operating budget. So we can kind of lay them side by side and see what is going on in the towns.
I'd like to go back to Claire and Barbara's first proposal, which was we scale back here to the minimum.
Yeah.
And we urge people to go to other centers as they would, as guests, rather than merge. I don't yet see the advantage of merging. So I put that back. What are the advantages of merging over doing all activities here and sending folks?
I can tell you one advantage. Judy doesn't have to worry about having coverage for podiatry. I'm giving up, I will not be reappointed, so they have to find somebody to be the treasurer. Somebody's got to answer the phones. Somebody's got to put out the calendar.
Not if we're not doing anything new.
We still have to put out a calendar, I would think.
In my mind, the calendar
website.
would be scaled
Yeah, on the website.
also where you'd have repetitious dates for, or times for various functions that could fit on our electronic sign. And Ellie's been good about putting the list in the paper, and that might be sufficient
Yeah.
for what we're doing.
But what it would mean is that if there's health issues and we lose a volunteer, then we just don't cut the activity.
Or
That's
see if
what it
anybody
means.
else wants to take it over. Yeah.
Right.
Yeah, yeah. Mhm. Well, there's 2 activities right here.
I say good luck with
Least important,
that.
frankly.
Good luck with that.
Not as important as podiatry.
No, it's true. I agree with you. Podiatry is very, it's important to the town. It's very important. Yeah, it's important.
I think, Claire, where we're so much in limbo right now,
Yeah,
I think it would be kind of unfair and selfish on our part to bring on an activities director,
Right.
just to have to say to her,
Good point.
6 months from now, 9 months from now, I'm sorry, we're closing. Screw it,
Yeah.
Wouldn't apply for the
Right.
job.
that's a good point,
Very good.
Priscilla. That's a good
You know,
point. It's unfair. Yeah,
We were in limbo.
yeah.
We were more, you know,
Definitive would be another thing.
Right. right?
Was there a second to the motion?
I second. I'm trying to remember your motion, but I second it.
I have, starting November 1st, we curtail activities to a minimum. See list above.
Yes.
All I got.
I second. All in favor? Aye. Opposed? Abstain. Unanimous.
Okay.
I do have one quick question.
Sure.
Is it still okay that I book Ella's for November?
Yes. Oh, please. You are, yeah. And we're doing lunch bunch. Oh, yeah. People like to eat.
Ella's was so good last
Yeah.
year.
Yeah, yeah. No. Yep. People like to eat.
Okay.
Anything we have a sponsor for, we'll continue.
Okay,
Mm-hmm.
This lunch bunch sponsor.
okay.
Yeah, you are the sponsor and,
All right, just
yeah.
November.
And you and Judy, the pen pals.
Yeah, okay.
Yeah.
You know, in traveling around a little bit, we offer a lot
Or a little place.
for a little place.
Yeah.
You know, when you compare the activities in some of our places. Yes, Rutland has some specialty people, piano players and those, noted watercolorists. I've done that one. But if they didn't reside where they do, they might not be doing those things in that town either, where a town could offer them. I think for us, we've offered a lot.
Impression I get, Rutland's gonna be looking for money too.
Oh, yes,
Everybody's always looking for money.
they definitely will.
Yeah.
I think it's the same though for all the towns.
Yeah,
Barry's going to have to look.
yeah. I already heard some noises coming from Rutland about fiscal issues.
Mhm.
Okay, I'm gonna raise one issue about Rutland, and I really like Rutland. You know, Rutland's a wonderful town, and it's a wonderful senior center. But they have an over 55 village built where Rutland Heights Hospital is. It's it's a big thing. Anyway, there's 74 units. Each unit has 2 living spaces, apartments, whatever you want to call it. So if each of those, that's what's that? Let's say 150 something. And if there's 2 people in each of the 150, you're getting into what, 300, 400?
300,
Yeah.
300.
So those 300 people will become residents of, they're over 55. So they're eligible for a senior center and they're residents of Rutland. So I see that they're probably eligible to go to the senior center. And so I mentioned that to somebody. They said, oh, no, they'll be going to they have a clubhouse there. And I say, no. They'll all be going to Dunkin' Donuts in the morning and they'll all want to go. They'll want to do anything. Maybe not. Not all of them, but even if a portion of them went to Rutland, that would really be, and it's safe. We went to Rutland and then these other people came to Rutland. Rutland's, hopefully the town would have to increase their budget because they're having a large amount of people, okay? So I just throw that out at you, just put it in the back of your mind. And I don't have all the information at all, but I just see this as a potential issue for Rutland Senior Center.
If we do talk to other senior centers, I think it's important to know that from our statistics, we see 22 active people from us.
Yeah.
And the other important thing that what you say, Judy, makes me want to ask the question of your senior center, of your seniors population, what percentage attends?
I don't know.
Yeah.
I think.
What percentage attends? So how much more can you absorb
Right.
without increasing your overhead because you have available space, because you're not having that many people come? So usually what you do is you say that our percentage is X, Y, Z. And if we have a population moving in at 200, well, you apply the same percentage to them and say, theoretically, that would be the increase that we would be serving.
And having gone to some of the exercise activities, sometimes they can be spotty. Sometimes you'll get like a good 20, sometimes more. It's a big room. There's probably more. And then sometimes it's less.
Right.
Now they have this Marty who, everybody really loves for exercise. There's been
She's been
times
there
it's been
forever.
3 people there, 5 people,
You see this?
Yeah.
And Marty will say, why are you having this problem here? Where are all you people going, And so it's everywhere, even in a really
It is.
Yeah.
well-run, modern.
Look at us, Judy. There's, I've been to functional fitness where there's been like 5 people. Today, there was, we set up 18 chairs, 18 people. I mean, yeah.
And the same with yoga. I mean,
Yeah.
we came down to 4 of us for a while.
Yeah.
Then we came up to 10.
Yeah.
So it comes and goes depending on.
Right now, we're holding at 9. When you come back, we'll be at 9.
Okay.
Yeah, we'll be holding at 9. It is, like you said, Judy, it's strange because people come and they go and they come and they go. Yeah. Yeah.
Do you know when you have to apply for the formula grant?
I'm waiting for Adam Frank. I mean, I talked with Nancy. She went through her files because I said, I'm getting worried. And she went through her files. She said, I don't have anything either. So that's why I contacted her.
Before our next meeting, you'll have to apply for it?
I think so. Yes,
Right.
absolutely. Yeah. I'm anxious to watch to see if we get the money like Nancy said we should, even though we don't fill out the questionnaire. She said they tend to give it out anyhow. Should come in November. So it did last year. That's what I'm going to be looking for. In the meantime, I'm going to be sending him.
So this year, we're going to apply for the formula grant.
Oh, you bet. Oh, absolutely.
Okay, so we're going to be open for this year.
Yeah, absolutely. I'm getting that formula grant. All
It gives us time.
$7,799 or whatever it is. I mean,
It gives us time to see how popular our restricted activities are. If we continue to maintain the numbers that they have where we're saying they're the most popular things, then you continue that way or add on one thing at a time that might work.
I
But
can start giving information to folks about the other senior centers and what's available there and see how that plays out. Do people take advantage of it?
right.
Or do we really need something?
I didn't know if we needed to put out a letter prior in place of the Herald for November, saying that we are curtailing some activities.
I'm going to come out with one more Herald at least.
Oh,
So I want to report on what we're talking about here.
okay.
Yeah.
So people know.
Right, but in that, to have websites for people to reach out to Rutland, Berry, and North Brookfield with maybe some of their more popular activities listed, that kind of thing.
Yeah.
So if you want to do the Herald, that's fine. I was thinking a letter, but that it serves the same. And do we restrict the Herald in November to just those who normally receive the Herald, or should it be townwide so that everyone is aware?
I
Because
think the last one should be townwide.
Yeah, I do too. Yeah.
because of 571, what are we mailing out? 140, 150, either email or hard nail, that's a quarter of.
Yeah.
Or so, or a third of what we'd normally. Now, some of those are husbands and wives, so maybe I'm off with that, but
So that would be downloading all the names and addresses out of my senior center.
I think it's really important to have in the final letter. And before that, we should reach out to the senior centers to tell them that we're doing this. And I think we should have the emergency contact. I don't know if you want to call it emergency contact, but the contact, if you are in need of a service,
Right.
you know, that's not currently, and you can't get that information, please reach out to and give them phone numbers and contact information.
that's a good idea too.
Okay, we've done that before. We should do it again.
So-
Right,
We've sent out the contact numbers before. We should do it again.
right.
Yeah, I definitely think in the final letter, we should make sure it's kind of like, you know, an alert to the town. That I'd like, make sure the vulnerable people.
Claire, the benefit of doing townwide is we don't need labels. It's every household.
Oh, excellent.
So there's no, you don't even have to think about downloading my senior center stuff. It would be every. it would be- I know, well, you have to hear it. So
I've seen the download and the way the download comes, I'd have to drag it into Excel and reformat. I'm like,
So those that's an every household mailing, so you don't have to think about that.
Let's do some more.
great.
Oh, so I'm
Much
not
better
saying-
now.
The labels are a
It
lot.
could be worse.
Yeah, yeah. Oh, much better now.
Okay, well, that's my report.
That's your report. Okay, so we need to come up with stuff for November's. And that would include the Bemis one in
Yeah.
December. So any activities we know are going forward in December also.
Okay, all right.
Bemis is the only one I'm
In
aware of.
December, yeah.
A lunch bunch.
Yeah.
Lunch bunch.
Yep.
No, actually, my actual report is only this, that we did get out the policies that I promised to get to the new members. But one policy isn't getting handed out. That's the conflict of interest regulations policy. And Maribel said that's online. It's long. So
Oh,
Yeah.
I didn't copy it up. But if you go to the town website, right? They have the policy there on conflict of interest. So you should have all the policies you need at this point available, one or more available to you. Okay,
And just one thing, Priscilla will not be able to be at the lunch bunch this month at Black and White.
White.
Yeah.
Okay.
Right.
So, and we can't be there either.
okay.
Barbara, are you going to be there by any
I
chance?
probably am.
Yeah, okay.
I'm not gonna be there, right?
Yeah, so would you guys,
Quickly voting you.
yeah,
Oh,
okay.
and Diane doing lunch bunch?
Yes.
Okay.
I'm just thinking that, well, I guess we can wait until November at hours to decide what we want to do for December. So now we don't have to worry about it.
Oh, to question what we'd like to do.
Yeah, because we
Gotcha.
get that going, that we
Yeah.
decide at the
Yeah.
lunch where we want to do it.
Yeah. You bet.
And then I put that in the calendar and we would put that on the town website or,
Next.
Want me to still keep the black and white for next
oh,
month?
you bet.
Yes.
What's that?
Yeah, those guys are going to black and white.
In the same place.
Oh, okay.
So you're doing both?
Okay.
No, I'm
Gotcha.
not doing.
Okay, so,
covers the agenda.
yeah, so I was going to say, make a motion to adjourn.
Second.
All in favor?
Yay.
There you go, it's 1:30.
All right.
Is it that magic?
So that's slow. That's slow. It's 1:53. The clock's slow.
Did they fix the leak?
That's right.
Yeah.
Yeah.
Looks good though.
All right. Well, okay. So we ended 10 minutes earlier than we usually do. That's pretty good. We're on a roll.
The last month.
Yeah, we're on a roll.
If you need a backup.
Number with-
Oh, that's Kristen. Okay. Okay.